right, everyone. Hello and welcome back. What a fantastic start we have had to the summit this morning. And I hope you're all energized from the program that we've seen so far. And we are going to be continuing to learn, think, and prepare in new ways. So, to get you thinking once again, along slightly different lines this time, our first solution spotlight will shine on a recent effort to prepare the world's healthcare workers for new threats to human health. Dr. Kimberly Humphrey is a climate change and human health fellow at Harvard School of Public Health and a visiting scholar at the Harvard FXB Center for Health and Human Rights. Ladies and gentlemen, please welcome our fellow Aussie today, Dr. Kimberly Humphrey, to the stage.
Hello, can everyone hear me okay? Perfect, lovely. Thank you very much. Okay, so let me just go there. So what I first wanted to talk about, I'll be talking about curriculum, but I'm going to be talking about healthcare curriculum and education in quite a broad sense. So I'm not just going to be standing up here talking about what we need to do in our medical schools and things like that, okay? So anybody who has been through medical school knows that traditionally it's been very pathology or disease focused. So it started off as a couple of 4-month sort of apprenticeships is how medicine in the US sort of started, and you just go and learn on the job for a few months and then go and do. Even with the evolution of that, it developed into pathology-based models. So you'd learn about really the disease processes, and the evolution of that when I went to medical school was around problem-based learning. So you would get a case, might be somebody who has had a heart attack, and you would learn about the heart, and then you would learn about the medication they needed. And what we didn't learn about was all of the other things that come into health, certainly not climate change, but all of the social aspects and equity and everything else that forms a part of somebody's well-being was not well taught then. Still, we have seen that that has changed in many medical schools, but it's not where we need it to be yet. So if you have a look at this slide, we still see that 80% of medical education is focused on biology. So it's 80%. But 60% of premature deaths are not related to just the biology. It's about social and environmental factors and the other things that make up somebody's health. And it's very illness focused. So when we learn in medical school, we learn about illness. We don't learn about the well-being of people and what it is to live well. We learn about how to treat sick people. And there's a really significant sickness focus. A recent survey, just to give you kind of where we're at with this, showed, and this is in 2019, quite a significant International Federation of Medical Students survey, had a look at medical schools worldwide, learned that 15% of medical schools had mentioned the climate change in the curriculum. Only 15%. When we have heard this morning about how this is the biggest threat to our health ever. Only 12% of medical schools had student-led climate change in the curriculum. I was speaking to Dr. Dina just before, and she was telling me that a recent survey in India found that only 60% of medical schools had mention of climate change. Now, whether that's a discrete unit or whether that's spread throughout the curriculum, it still isn't where we need it to be. The barriers to climate change, I'm sure many of you have heard some of these things. It's not relevant, it's not real medicine. I've heard about this in climate change circles, is what does health have to do with this? Which to me is quite mind-boggling, as I'm sure it is to many of you in the audience. And then a lack of frameworks and a lack of curriculum. Many of those things are changing or have changed. There is a lot of curriculum being developed. There are a lot of frameworks that are now out there. As was mentioned at the beginning, Harvard has recently made this announcement. Now, I think this is really significant, not only in terms of such an important institution embedding climate change, but the way it is being done. So what we had seen up until the last probably few months really, is when there is an appreciation that climate change is necessary, it's been in these discrete little blocks. So you might have a couple of lectures on climate change and health, for example. In the medical school that I studied at in Australia, that's exactly what it is. It's 2 hours, it's, climate change and health, and it's optional. So I think 10 students went last year, which really understates how important this is. What Harvard is doing is embedding it across the curriculum, which is what we need to do. It needs to be integrated as part of medical learning in every part of the syllabus. It needs to include focus on the social and environmental determinants of health and equity. It needs to be much broader than climate change causes a little bit of heat stroke. We've done this quite well with smoking. So for decades, there's been integration of the impacts of smoking, for example, throughout the medical curriculum. So we study the pathophysiology of it, we study how it integrates into well-being in the body. Nothing like that with climate change. But it exists. We need to get this into all medical subjects. So when climate change has an impact, and it does for most body systems, we need to be able to bring out these mechanisms and say, okay, as part of your learning on heart disease, we're going to talk about how climate change affects the heart. And the material is already there, we just need to use it. Many of you would be familiar with this, I think, and this is just to highlight that the health impacts of climate change are significant. I need to say no more on that. We know that it affects every aspect of health. It affects all body systems. I really like this model, and this is what I want to spend a moment focusing on. So this brings in not just the biology and the biological factors that affect someone's health, but society, the social determinants of health, and environment as well, and how important they are. Equity, as I mentioned, is a huge part of this. So we know that within countries, there is inequity and health disparities in how climate change affects people. We know that people who are from communities of colour, people who are from lower socioeconomic communities, they bear a disproportionate burden of disease from climate change than those who live in different communities. And we see that historically as well. So this is some data about the effect of redlining on heat, which persists to this day. So we know that areas that were traditionally redlined are significantly hotter in cities. So they have greater impacts of heat on their health than other communities do, and that persists. So when we're learning about heat in medical school, it shouldn't just be about heat stroke, which is what I was taught. And I'm an emergency physician, and even in my residency training, what we learned about heat was heat stroke. The end. Not things like this, like maybe where is your patient from? Is it the fact that there's not good green space in their community that is impacting on their vulnerability to heat? We should be teaching our students all of these things. And this is just underlining that heat vulnerability has many, many parts to it. It's not just about your biological predispensity to having ill effects from heat. So it's not just about being elderly, it's the community in which you live, it's your social networks, it's your environment. There's so many things to it that need to be part of a foundation of teaching about health. And this is that wonderful diagram again. So if we go down looking at the biology, this is what we've been taught in medical school really. Even when we've been taught about individual behaviours, so obesity, lack of exercise, smoking, it's very blame-based. So it's about you and why are you overweight and why do you smoke? And we really need to be teaching our students, and not just in medicine, but in health generally, that there's things in society that make that happen. And it's not about blaming that person, it's about looking at the root causes of these things. So this part of it is generally what our biomedical model has been teaching us. When we're looking at social determinants of health, we need to know and understand and teach our students how climate change exacerbates these inequities. We need to think about the solutions that address both of those and that build adaptation to climate change, and that social capacity building. We know that socially cohesive communities have better outcomes during heat waves. When people have those networks in society, they do better, they get out more. It's better for their health. We need to make sure that our students appreciate this. And finally, the environmental determinants, so the intersection between environment and health, the impact of urban planning, the greening I talked about before, looking at transport, and we shouldn't just be thinking about electric vehicles if we're thinking about reforming our transport. We need to think about the co-benefits of active transport. It's much better for people to walk and bike and to get out and be social and be active in their communities than it is to drive an electric car. So we need to really be embedding this into our students' learning. This is a framework for integrating climate change concepts into the health curriculum. So firstly, we have planetary health concepts. So that's the intersection between health and the environment. That's the concept of one health and how the health of everything around us affects our health. These things have not been well taught to our students, and we need to make sure that they fundamentally understand all of these things. the environmental justice and social determinants of health. So understanding those intersections I talked about before, and the impacts and the solutions as well. As I talked about, there's mechanisms as well for disease. And climate resilient health systems, which include the role of public and preventative health. I was delighted to hear mentioned this morning about how we need to make sure that people generally have a better standard of health. They present less to hospital because we invest in public and preventative health. We treat chronic disease better. We stop people getting as sick as they have been, and that reduces the burden on the health system, but it also makes them more resilient to the effects of climate change as well. So it's an adaptation mechanism as well as a mitigation mechanism on carbon emissions and the co-benefits I mentioned. Sustainable low-carbon health systems need to be a focus. First, do no harm is what we're taught in medical school. We, and I say that as a global community, are not good at practicing low-carbon, high-value care. There's a lot of inappropriate test ordering and a lot of things that are not centred on people's health. And that comes from the structure of our health systems, which are generally based around, where I'm from in Australia, it's activity-based funding. You get funding for doing things. Doing things are not always best for your patients. There's a lot of for-profit medicine. So much of our medical systems are geared towards doing things to get money, and it's going to take a huge shift to move away from that, but we need our students and our leaders of the future to appreciate that, and that it's not best for the health of our community the way that we're running it at the moment. The one thing I don't have on here, which I need to add, is policy advocacy and responsibility. As was highlighted this morning, we have a duty as health professionals to protect the health of our patients. We need to be making sure that our students and our junior health professionals understand policy and advocacy and their role and what they must do to protect the health of our populations now and future populations. This is just highlighting the kind of knowledge we need to know about sustainable healthcare systems, and this is highlighting the kind of knowledge we need to know about resilient climate systems, health systems. And note, it's not just about buildings, it's about workforce. It's about making sure that our workforce and our public health and everything is tied into making our communities as resilient as they possibly can be against the climate challenge. And this is one of my final slides. So this is health and climate co-benefits. I love this slide. It's brilliant. It really puts a positive spin on what we need to do, which is what we need. It is good for us and good for our planet to make these changes. We'll be healthier and happier, and we just need to get on, make sure that our students have the knowledge to do it. And finally, this is, I really like this. I spend some time sitting down looking at this slide sometimes because it really highlights, and I'm sure it's probably quite hard to see, but it's really embedding all of the things I've talked about, that we need to think about equity, we need to think about a just transition. We can address things like the Sustainable Development Goals and health disparities and inequities in our community whilst we address the climate challenge as well. If we can do those things, we end up right up the top in the green space there, where we have a more just, equitable, healthier community, and we reduce carbon emissions to a level that gives us a livable planet. Down the bottom is we just don't, or we do a kind of half measure, or we don't think about equity and we don't think about justice. And at the very least, we end up with many of the problems that we still have at the moment. So there is a fundamental shift we need to make globally. I think we have the tools and knowledge and connections to do it, and we just need to get on and make that move. Thank you.